नमस्कार, बहुत बहुत स्वागत। आप सभी का हार्दिक स्वागत है इंडिपेंडेंट रिसर्च एथिक्स सोसाइटी की आयुष समृद्धि ज्ञान गंगा में। आज हम 959वीं पायदान पर बढ़ते चले जा रहे हैं। आज लाइफस्टाइल डिसऑर्डर सीरीज पर हमारी पहली वेबिनार है। वी आर कंडक्टिंग वेबिनार on obesity, Sthaulya, cure and care. Our second webinar is on Patient Safety Day. We are celebrating Patient Safety Day today, and therefore speakers will guide us on patient safety, and Dr. Avita will also guide us additionally on patient safety in second webinar also. And in third webinar, we are going to celebrate Vishwakarma Puja today. Vishwakarma Puja unique rituals. So at a stretch, today we are conducting 3 webinars. Thank you again with regards and gratitude for your joining. Thank you very much. Now I would like to request Professor Vishnu Prasad Sharma ji, ex-principal Guwahati Ayurvedic College, for his welcome speech. Welcome, sir.
Namaskar. Thank you. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on obesity, Sthaulya, cure and care. In this webinar, we have eminent speaker. I want to welcome Dr. Avita A., Assistant Professor, Department of Rog Nidan, KJ Institute of Ayurveda and Research, Salvi, Vadodara. Namaskar, madam, and welcome you to this evening webinar. Next, I want to welcome Dr. Tejendra Singh, MD Scholar, Department of Sthaulya and Yoga, Uttaranchal Ayurvedic College, Dehradun. Welcome, Dr. Singh. Once again, I welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this evening webinar, Obesity, Sthaulya, Cure and Care, because obesity is a worldwide problem. How Ayurveda can help in this disease, we are waiting to hear from the expert. So once again, I welcome all the eminent speaker, distinguished guests, ladies and gentlemen, to this evening webinar. Namaskar. Over to Pavanji.
Thank you, sir. I would like to inform new speakers that this will be live. This program is live on YouTube. So additional recording is not possible, number one. And you can circulate this YouTube link to everybody. You can involve everybody. So this YouTube link is live and we are going to circulate it just now. So don't worry about that. That will be recorded and well kept at YouTube. Please circulate it. So I would like to request Professor V.K. Agnihotri sir, ex-principal Haridwar Ayurvedic Medical College, for his preamble.
Thank you, Professor Pawan Kumar Sharma ji, and namaskar to all the respected guest speakers of today's webinar, and also all the dignitaries who have joined this platform to evening, celebrating our 959th webinar. As we have discussed that our today's topic is obesity, Sthaulya, cure and care, which falls under the category of lifestyle disorder. We all know that lifestyle disorders category itself is the subject matter which is discussed in Asthaulya Purusha or Asthaulya Adhyay. In that way, it is important to see that Atikrash, in comparison to Atikrash, Ati Sthaulya persons are rather more difficult to treat or to handle with. And this Sthaulya itself leads to so many diseases, may it be under the influence of hormones like thyroid, or in case of overeating leads to diabetes or present premay. So Sthaulya is one of the, you can say, predisposing symptom, or at the same time related with the other causes which leads to Sthaulya. Both the things are in vice versa in sense, either based on the symptomatology or based on the hetu it ultimately leads to Sthaulya. May it go for Asya Sukham Swapna Sukham Dadhini, it ultimately Namanyapanam, it ultimately leads to Sthaulya also. So here our discussion will be to consider the best possible lifestyle uttered in our text, vividly described in a form of observance of Dincharya, along with the Upastam, which falls at first the Ahar. So intake of Ahar itself designs you and me the best possible health. If at all it has been overlooked, it may lead to either of the symptom or the disease like Sthaulya. So our guest, learned, distinguished guest speakers are going to throw light over the possibilities of all those factors which ultimately say precipitated in the form of Sthaulya, pertaining or concealing so many diseases. So it is an alertness to all the persons, those who are indifferent for taking any diet or indiscriminately consume so many things in the form of carbohydrate or excess protein, all that, or fat, they may lead to this thing. And also keeping much distance as far as the exercises are concerned. So it is very, very important to go for proper exercise as per the body's tolerance and acceptance, along with the proper demand of the diet of the body, depending upon the consumer or the user. These are few factors which will definitely save ourselves from the lifestyle disorders like Sthaulya. Thank you so much, and over to Pawan Sharma for further proceedings. Thank you. Namaskar.
Thank you, sir. Thank you very much. Now I would like to invite Dr. Abhita A. Welcome. You are on first time on our platform, but please consider this platform as yours from today. We dedicate this platform to you. Welcome, Dr. Abhita. Is there any problem?
Hello. Hello, sir.
Yes.
Sir, actually, I have sent my PPT. It is not from my here. It is maybe due to rain issue. It is not posted. I have shared my PPT to the WhatsApp account.
Okay, you start extempore. I am doing this. You can start your speech till then.
Okay.
In 2-3 minutes, I am doing this.
Okay, sir. Okay. Good evening, one and all gathered here. First of all, I'm thanking you for giving me a platform to present my knowledge in the aspect of the obesity, its cure and care. So, myself, Dr. Abhita, Assistant Professor, Department of Roganidhana एवं विकृत विज्ञान, KJ Institute of Ayurveda, Savli, Vadodara. So first I am starting with the prayer. Ragadi Rogan, Sadadana Shaktan, Asheshakaya, Prasradana Sheshan, Autsukya Moha, Radidanda Kana, Yopurva Vaidhyaya, Namostu. No one is that much love. They don't have that much love to the obesity. But there is all are loving a well-built body or no need of that obesity. So obesity is not considered only as a cosmetic concern. It is a risk for some health problems also. Like we know hypertension, diabetic mellitus, or come to the coronary heart disease and all those things, or the endocrinal disease. So obesity is having such a role. It is a huge public health problem nowadays. So coming to the definition of the obesity, a medical condition in which excess body fat accumulated to the extent that it may have an adverse reduced life expectancy and increased health problems. So we know there is a very, all are very much concerned about the health effect of the obesity, and this obesity result from the excessive consumption of the increased calorie intake that relative to energy expenditure for several years. And according to WHO guidelines, there is a method or the guideline for classifying the weight status by index, that is the body mass index, BMI. Body mass index is a simple index of weight for height that is commonly used to measure or classify underweight, overweight and obesity in adults. We know BMI is the weight in kilogram by height in meter square. When the BMI is less than 18.5, it is considered as an underweight. If the range is from 18.8 to 24.9, then it is considered as the normalcy. And coming to 25 to 29.9 is considered as an overweight. If it is in the range of 30 to 40, then it is obese. So here comes the obesity. If it is more than 40, then that is the very obese person. So this is as per the WHO guideline. Now, there is two terms, obesity and overweight. What is obesity? And what is the difference between obesity and the overweight? Coming to overweight, it can be due to a fat deposition or due to fluid or due to the muscle mass, or either it can be a bone or due to tumors. So coming to the obesity, it is due to the deposition of fat or the adipose tissue. So that is the main difference between the obesity and overweight. We know in Ayurveda, we are considering it as the Sthaulya, Adhisthula. So in the Adhisthula, in Charaka Sutra, 21st chapter, it is considered as Medo Mamsadi Vriddhatva Chalan Sthana Udarasthanaha Ayadobajaya Utsaha Naro Adhisthula Uchyade. So here Acharya explained that the excessive increase in the fat and muscle tissue in the region of the buttocks, abdomen and breast, which become pendulous, and with the patient or the person suffer from deficient metabolism. Either the catabolism and the anabolism, the patient is suffering, and also the energy. So this is the Sthaula Lakshana as per Acharya Charaka. Now, coming to the Nidana, we know to Acharya, Tad Adisthaulya, Adi Sambhurana, Adi Madura, Shida, Snigdha, Upayoga, Vyayama, Avyayama, Adi Vyavaya, Divasopna. So these all are the, or due to the Chinda or the Bija Swabhava. Here Acharya given importance to the physical as well as the mental faculty. So here, if a person is lacking physical exercise or due to his sedentary habits like intake of Adi Snigdha or Adi sweet, excessive sweet, Adi Madura or Adi Shita, such habit also will lead to the Adi Sthaula Lakshanas. And Acharya given an importance that the genetic factor, that is the Bija Swabhava. So here the hereditary or the genetic factor also plays a role in the Sthaula Lakshana. Then now come to the Samprapti. Samprapti in the Charaka Sutra, it is explained that Meda Savrata Margatvat Vayu Koshte Visheshadaha Charan Sandushat Tagni Ahara Shoshayatyabi Tasmat Vikaramsha Ashnute Khoran Gachit Kalat Adikramat. So here due to the Nidanadi Sevanas, Adi Swida, Adi Snigdha, Adi Madhura, all those Nidanas or the Divasopnas, that will lead to the Meda. Meda will get aggravated, or the vitiation of the Meda will occur, and which causes the avarodha of the Vata. So which causes, that will deposit or that cause the avarana or the avarodha in koshta. So due to the avarodha of vata in koshta, the Agni is going to hamper. There is a vriddhi of Agni. This cause Shikram Jarayati. If the person taking food recurrently, then also the person is that food or the ahara is getting jarana fast. So that he have to take excess intake of the food. Thereby the person is attaining Sthaulya. So that is the Samrapti according to Acharya Charaka, and in Madhava also same. Then coming to the epidemiology in modern, according to the World Obesity Atlas 2023 published by World Obesity Federation, more than half of the world population will be overweight or obese by 2035 without significant action. So it is there is a talk that the prediction of the WHO or the World Obesity Atlas that by 2035, in the year 2035, the global economic impact of overweight and obesity will reach 4.32 trillion annually. 35. So, at almost 3% of the global GDP, that is comparable with the impact of COVID-19 in 2020. Then the majority of the global population, that is 51% or over 4 billion people will be living with either overweight or obesity by 2035. This is the prediction. If current trend prevails, that is due to the fast food or due to all the sedentary habits that following all over the world, if the condition is following or the current trend prevails, then this is the thing happen in the year of 2035. 1 in 4 people, that is nearly 2 billion, will have obesity. The prevalence of overweight and obesity among children and adolescents aged from 5 to 19 years has risen dramatically from just 4% in 1975 to 18% in 2016. And in 2019, an estimated 38.2 million children under the age of 5 years were overweight or obese. Once considered as a high-income country problem, or either due to overweight and obesity, this is only related to a high-income country due to their sedentary habits and all. But nowadays, the rising this condition, that is the overweight or obesity, we can see in the lower and middle income countries also, particularly in the urban settings. For example, in Africa, the number of overweight under 5 has increased nearly 24% since 2000. So this indicates not only in the high income countries, it's going to happen or occur in the low or middle income countries also. Next, we'll discuss about the type of obesity. There are 6 categories. Many classifications are there. I've selected a 6 classification that we are seeing the nowadays. It is common. So I have selected the 6 classification. First is the inactivity obesity, or the food obesity, anxiety obesity, venous obesity, or the atherogenic obesity. So first coming to the inactive obesity. So from the word, it is clear that a lack of physical inactivity can cause the person to become overweight. So physical inactivity in the adolescent age, which strongly predicted the risk of obesity and abdominal obesity. Here it is clear that the obesity, especially the abdominal area, is going to obese in young adulthood, favoring the development of a self-perpetuating vicious circle of obesity and physical inactivity. The physical activity should be a major target of obesity prevention in the young category in this inactivity. So here the cure or the care what we have to take is, here we have to do the physical activity. Next, coming to the food obesity. The food obesity, which occurs when extra calories are stored in the body as fat. So here it is clear the food is the cause. So consumption of fast food, we know nowadays that fast food is a trend. So the consumption of fast food, which is having high energy densities and glycemic loads, and is frequently associated with the weight gain. The reason behind is the fast food, which is contain very fewer vitamins, minerals such as vitamin A, carotene, vitamin C, vitamin E, calcium, magnesium, and zinc. Data from the longitudinal Framingham heart study found a 6 to 7 year decrease in life expectancy for overweight individuals over the age of 40. If the condition prevails, this is the data that have given by the Framingham heart study. The age life expectancy is going to reduce. So, next is the anxiety obesity. The obesity which is associated with the most of the anxiety disorder and depression. So anxiety, nowadays it is common, the anxiety or the depression condition, adipose and gut-derived inflammation and changes in brain nutrient composition stimulate neuroinflammation. Neuroinflammation alters structure, excitability, and connectivity in corticolimbic network controlling mood and motivation and emotion. Mounting evidence reveals that the psychiatric consequence of the obesity stem poor diet, inactivity, and visceral adipose accumulation. So this is the main cause behind the anxiety obesity. Next, come to the venous obesity. Venous obesity that we can see in the pregnancy time in a female, and the most common manifestation of the venous disease was the presence of the varicose vein followed by venous stasis eczema. Higher BMI is an important risk factor for a chronic venous disease. The diabetes and hypertension can be a comorbidities in patients with chronic venous disease. So thereby the obesity. Next comes the gluten obesity. The gluten, we know it is nowadays the gluten obesity is also plays a major role in the manifesting obesity. So gluten is the protein found in wheat, barley, rye. So it is an ingredient with high calorie, highly processed food in its overconsumption contribute to the weight gain. But gluten as individually, it is not going to induce weight, but if it is taking high calorie, if it is there, then that is going to overweight or the weight gain. An autoimmune response to gluten is called celiac disease. In this case, gluten is mistaken as a toxin and overreact and send inflammatory cells and antibodies to destroy the gluten molecules. So gluten also plays a role in the obesity. Next, come to the atherogenic obesity. The atherogenic obesity associated with an increased risk of coronary heart disease in the CHD due to its strong association with atherogenic dyslipidemia characterized by high triglycerides and low high density lipoprotein. So the good cholesterol is getting down. And the dramatic increase in the prevalence of obesity has led to a marked increase in the metabolic syndrome characterized by visceral adiposity, insulin resistance, and thereby elevation of BP. So these are the 6 types of obesity. And now coming to the factors responsible for obesity that we know, the behavioral and lifestyle factors, the disease, some certain diseases are there, some mental illness and genetic factor. So first is the behavioral and lifestyle factor. We know the unhealthy dietary pattern due to the high intake of carbohydrate or the increased frequency of eating. So next is the less physical inactivity, that also a type of obesity that we discussed. due to the sedentary lifestyles and all. And some medications also plays a role, like antidepressants or anticonvulsants or the oral contraceptives. So such things also plays a role. Next is the less education and skill. Due to that, their lifestyle is getting modified due to their education, and they used to eat that high unhygienic food or such things also going to induce obesity. And food marketing and promotion, it is nowadays it is common that due to food marketing is by showing such advertisement and all will get attracted towards that, and surely we are going to purchase that things and we will taste, thereby the lifestyle is getting affected. And the unfavorable physical activity common in all professionals. Most of the professionals are suffering from this physical, due to they are suffering the lack of physical activity. Now certain diseases are also there, like endocrine diseases in thyroid and all, then in PCOD, polycystic ovarian disease, Cushing's disease. These are the certain diseases affecting the obesity, leading to the obesity. Then coming to the mental illness that we already discussed in the anxiety obesity type, anxiety, depression, that also a cause. Then coming to the genetic factor, due to the leptin deficiency, we can the person can become obese. That also plays a factor. In our Ayurveda also, Acharya explained the bija, given an importance to the bija factor. So next come to the prevention. In the prevention, we have to start from the infants. From the infants, we know nowadays all type of food, like for if the mother is working or due to some problems of the mother side, there is a chance of giving more tin food or packet foods like lactogen, such food they used to add in infant time. So if that factor also plays a role in making a baby to overweight in the future. So maximum we have to take care in breastfeeding at least up to 6 months. So the longer babies are breastfed, the less likely to become overweight. As they grow older, likely, very rare, very likely, like 10 to 15% chance for becoming overweight. Next comes to the children and adolescents. So we know the young people used to become more overweight or obese because they don't get enough physical activity in combination with the poor eating habit. Both inactivity and the poor eating habit. These plays a role, and some genetic factor also will be there, but lifestyle also contribute more in the children and adolescents. There are few steps to prevent the overweight and obesity. First is encourage physical activity. We have to send our daughter or son for some physical activity, either in the playing ground, or we have to give some time for them to play. So that we have to promote. Thereby they will lose the weight, or their activity is going to improve. Thereby their calorie is getting used, or the energy is utilizing. Next, change family eating habit. Nowadays, for a function or whatever it is, they used to go out, they will have food together in hotel or restaurants. So such things, we have to change the family eating habits, so that they have to consider, or they have to focus on the weight, and they have to change the habit. Then comes to the encourage children to eat only when hungry. We know whenever they are getting food, if for a function also, we know for a function there will be a welcome drink, then after that starter, then again. So such things, if they are hungry, then they have to take such food. If they are not hungry, tell them no to have food, and tell them no to eat food in fast. So that also give, thereby also we can prevent the obesity. Then we have to, as a parent, we have to serve at least 5 servings of fruit and vegetables daily. Not only a carbohydrate, that much rich carbohydrate to fat food, we have to concentrate in giving fruits or vegetables. And next is avoid using food as a punishment. Such things also, even it can give an impact towards their mental health also. So such things they have to change. Then avoid soft drinks, snacks, which is having high content of sugar and fat content. So encourage children to drink normal water or fresh juice, not rather than giving a soft drink or fresh juice as a drink, or which added with more sugar content. Then what we can do is be a role model. Parents who eat healthy food and are physically active set an example, and that increase their children will do the same. Then comes reduce time in front of TV and computer or in mobile. So at least reduce the screen time, less than 2 hours a day. So these all things we can prevent in the childhood and the adolescent. Next come to the adults. In adult, somewhat same, we have to follow. And one thing is eat 5 to 6 servings of fruit, vegetables, and that of saturated fat, weight and measure food to gain and understanding of portion sizes. And one more thing, what we can do is weigh yourself regularly, so that we will be little bit concerned about our weight, whether it is increasing or not, that we will be concerned about that. Avoid food that are high in energy density or that have a lot of calories in a small amount of food. Then make an opportunity during the day for even just 10 to 15 minutes of some calorie burning activities, that we can add our yoga. We can do at least for professionals, at least before starting their job, their work, they can spend at least 10 to 15 minutes before starting or in between their work. It will be very positive. They will get some positive and their calorie is also getting burned up. So that all thing we can do in adult. Next, coming to the treatment part, Acharya Charaka explained the Nitya Sevaniya Dravyas, Shashtikashali, Mudgamcha, Tainda Vamalaki Yavan, Antarisha Payam Sarpir, Jangalam, Madhuchabhyasir. So here Acharya explained we have to take a whole nutrition. We have to get a whole nutrition. So Acharya Shashtika, having carbohydrate, rich in carbohydrate explained. Then Andariksha Paya, minerals, for that Acharya explained. Then Saitava, then Amalaka, Yava. Then for all these carbohydrate, lipid, protein, vitamin, mineral, water, all these 6 major nutrients is Acharya explained in this sloka. For the fat, it is Sarpi is explained. So such things Acharya is very much concerned, and he already given a key point. Next is, according to Charaka, the treatment or the Sthaulya is Vadatnyan and Bhanani Shreshma Medoharanicha, Rukshoshna Vaste Tishna, Rukshani Udurtananicha, Guduji Hadramustana, Prayogas Tribalastada, Takrarishta Prayogasta Prayogo Makshigasija, Vidangam Nagaram Chara, Kala Loharajo Madu, Yava Amalaka Surnamcha, Prayogam Sreshta Muchede. So here Acharya have given important to them. Some Takrarishta Prayoga, Yavamalaka Surna Prayoga, then some certain drugs Acharya explained. Before moving to that individual drug explanation, we'll see the Shodhana and Shamana Chikitsa. In the Shodhana Chikitsa, Acharya has given Vamana, the medicated Vamana Acharya given. So nowadays in all spa or such, even in our Ayurveda clinics, what we are doing is, we used to give the Vamana Chikitsa. So the Snehapana and after Snehapana, the Vamana, then after following all these procedures, there will be a reduction in weight. So obesity, for the obesity management, Vamana also plays medicated virechana, depends on the dosha, avastha. Either a physician will give Vamana or a virechana. Then for Basti, especially Lekhana Basti plays a major role in Sthaulya, Sthaulya. Then Ajari given Ushagadi Gana will place a role in, like Ushagadi Gana can be used as a Lekhana Basti. Then come to the Rekta Moshana, Dhumapana, then Swedana, then Udvartana. It is common Udvartana we used to do in our clinic. For this, by using medicines like Triphala, Musta, Nimba, Kola Kulatadi, Lodra, Mustadi, Dariparidra, such drug we used to give for the Udvartana. Then coming to the Shamana Ushadi, this is the pacification therapy with herb, diet, exercise and lifestyle. So in the lifestyle we can add the yoga therapy or the exercise also. We can add some yoga therapies, yoga like even Pavana Muktasana or the Surya Namaskara, daily Surya Namaskara add on to our in the exercise or in the morning or evening session. If you are adding the Surya Namaskara, that also give a very good result in the obesity management. Then comes to some herbs like Triphala. This Triphala, which balance the Tridosha.
Fast, madam, time is over. Slide fast.
Okay, sir. The last slide, then. Okay, the Triphala, which is balance of the Tridosha, which is rejuvenating also. So thereby, this Triphala drug is playing a role in reducing the serum cholesterol, which reduce serum cholesterol and reduce the plaque formation in the arteries. Next is the drug Gugulu. You know, Gugulu is Medohara, and which is also having the rejuvenating and which reduce the cholesterol and the triglyceride, also the HDL-LDL ratio. Then the Vidanga, which is Vata Kapha specifying and which is also having a diuretic action, is also mild purgative, appetizer, blood purifier. So Agni can be rebirths, then rejuvenator, and then next is the Shilajadu. Shilajadu Prayoga, it is Vata Kapha balancing and which decreases the excessive fat, anti-inflammatory also it is, because we already told in the obesity there is a neuroinflammation. So this Shilajadu is an anti-inflammatory. So in such condition we can use, and is also an antioxidant. So hereby I'm concluding. So the obesity, the medical condition that we know the excess body fat is depositing. So by our lifestyle, by changing our sedentary lifestyle and adding some yoga or some exercise, some physical activities, by that we can change or we can come to the normal, or we can get rid of this obesity and we can lead a good healthy lifestyle.
Thank you.
Thank you. Thank you.
Thank you very much. Very nice explanation, nice voice, nice content, excellent. Welcome to this platform. Please do join whenever you have topic of your choice. Thank you. So nice of you. So nice.
Thank you, sir.
So now I would like to request Dr. Tejendra Lingwal. Tejendra Singh, welcome. So I hope theoretically is covered more, so we can discuss practically more, in my opinion. Welcome.
Namaskar. Very good evening to all the respected dignitaries. Today I will present my topic on obesity, care and cure. जो काफी इम्पोर्टेंट टॉपिक है आजकल ओबेसिटी डे बाय डे क्लिनिक में देखने को मिलता है एंड ऑलरेडी डॉक्टर अबिता मैम एक्सप्लेन्ड many aspects of obesity in treatment part, so I will go in first. यहाँ पे एक डाटा दिया गया है रिगार्डिंग द ओबेसिटी एंड ऑल. 17.4% overweight and obesity prevalence in India in 2019, and it like around 64.5% projected overweight prevalence in India will be in 2060. So it's too much high. And about, if we'll talk about diet cost, medical and non-medical. So 2019 में जो था 2,334, and it's in 2060 it will be 43,000. It means 1% to 2.5% of total GDP. So it's huge thing. So we have to more focus on wearing a normal society and our patients regarding the obesity and its consequences. So what is obesity? Obesity especially refers to an excessive amount of body fat. Overweight means excessive amount of body weight includes muscles, bone, fat, and water. How is obesity measured? Is according to BMI. It's about BMI 19 to 20 means normal. If it's 26 to 30, जो ज़्यादा लोग आते हैं इस कैटेगरी में आते हैं around 26 to 30. So they are concerning regarding वो उनको मैनेज करना है. They can manage their weight with diet and lifestyle and थोड़ा बहुत modification करके. And if someone is like a 30, BMI is 30 and more than 30, so they needed some medication, some herbal based medications along with diet and lifestyle management. Now obesity measurement and health risk. Waist to hip ratio. Male में and female में थोड़ा difference है. If it's like a more than 1 in male and more than 0.85 in female, it's high risk. And waist circumference की बात करें तो male man में अगर waist का circumference more than 40 inches है and woman में more than 35, so it's concerning. WHO report globally with more than 1 billion adults overweight, at least 300 million of them clinically obese. So एक डाटा है वर्ल्ड मैप का. ओबेसिटी रेट्स आर एक्सपेक्टेड टू राइज बाय 2035. ये एक दूसरा डाटा है रिगार्डिंग इंडियाज ओबेसिटी. 1 out of every 4 persons are obese now in India. So इस बहुत बड़ा कंसर्निंग इशू है कि जो आजकल हमें दिखने को मिल रहा है. इवन ओपीडीज में हर सेकंड पर्सन उसके जो अदर सिम्टम्स है उसका रूट कोज ओबेसिटी, आइदर वो जॉइंट्स पेन हो, आइदर वो डायबिटिक हो, आइदर उसे कोई और इश्यूज हो. Causes of obesity, genetic factors हैं, environmental factors हैं. The main important factor is lifestyle, diet and physical activity. Social factors also involved, cultural factors also there, type of food and way of cooking. हम कैसे खाना प्रिपेयर कर रहे हैं is the main thing. कि either we are using the more modern things like a micro oven and all, हम कुकिंग में रिफाइंड ऑयल यूज कर रहे हैं, हम रीहीटेड ऑयल यूज कर रहे हैं, दोबारा उसको कर रहे हैं. तो ये बहुत बड़ा मैटर है कि हम खाना कैसे प्रिपेयर कर रहे हैं. Diseases like hypothyroidism syndrome and PCOS also related with the obesity. Drugs like steroids and antidepressant का भी कहीं ना कहीं कॉम्प्लिकेशन ओबेसिटी में रहता है. एंड वन थिंग इज लाइक आजकल देखने में देखा जाए जो मनोरोग है, most of the mental disorders, the psychosomatic disorders, they also have consequences regarding the obesity. उनमें एक उन पेशेंट्स में एक तो जो उनका डिप्रेशन वाला फेज कहें या जो उनके ड्यू टू कॉम्प्लिकेशन ऑफ द मॉडर्न मेडिसिन, एंटी डिप्रेसेंट्स एंड अदर थिंग्स, सो उसकी वजह से भी वेट गेन इजीली हो जाता है. हेल्थ रिस्क, डायबिटीज टाइप 2, हार्ट डिजीज, स्ट्रोक, हाई ब्लड प्रेशर, मेनी टाइप ऑफ कैंसर्स, फैटी लिवर जो आजकल बहुत देखने को मिल रहा है, ऑस्टियोआर्थराइटिस. द बिग रीजन इज फॉर ऑस्टियोआर्थराइटिस इज आल्सो ओवरवेट. द नी जॉइंट आर्थराइटिस लोगों में काफी है, लोग नी रिप्लेसमेंट ले जाते हैं बट दे आर नॉट फोकसिंग ऑन द रूट कॉज. काफी नी जॉइंट आर्थराइटिस में जो मेन रूट कॉज रहता है कि उनका ओवरवेट. सो नी जॉइंट हमारे वेट बेयरिंग जॉइंट्स हैं, सो दे आर नॉट फोकसिंग ऑन द रूट कॉज, दे आर जस्ट गोइंग फॉर हिप नी जॉइंट रिप्लेसमेंट, बट फिर भी उनको सेम थिंग, द पेन इश्यूज इज स्टिल देयर. Sleep apnea and other breathing discomfort. This one is also very common nowadays, sleep apnea. People who are doing sitting jobs and like who are mostly in the luxurious setup. सो उनको एक बहुत बड़ा एक रीजन है कि स्लीप एपनिया का. नाउ दे आर यूजिंग द मॉडर्न थिंग्स, बट वो एक रूट कॉज पे फोकस नहीं करते हैं कि उसका रीजन क्या है उसके पीछे. एंड नाउ डेज इनफर्टिलिटी इज बिग थिंग. उसका भी एक बहुत बड़ा कॉज है कि ओबेसिटी. ओबेसिटी मेदो रोग इन आयुर्वेदा इज कॉल्ड मेदो रोग और स्थौल्या, a disorder of मेदो धातु adipose tissue. स्थौल्य संतर्पय जन्य विकार है, ओवर न्यूट्रिशनल डिसऑर्डर. Causes of obesity in Ayurveda is like overeating, frequent food intake before digestion of previous meal. ये आजकल इस पे कोई फोकस नहीं कर रहा है. Even like we are just checking our time, we are taking meals, we are not focusing about our agni and it's like a digested or not. And kapha increasing food, all the heavy stuffs. Excess consumption of sweet food, heavy foods, and mostly the packed dairy products. Excessive use of red meat, new grains. Ayurveda में भी recommend mention किया गया कि we have to use old grains, at least 1 year old. Use of sugar canes, jaggery preparations, excessive use of rice, wheat, and black gram. Drinking water after food intake. Obesity, मेदो का treatment in Ayurveda. Sodhan Chikitsa already mentioned like a Vambana, Virechana, Basti, and Swedana. These are the part of Panchkarma we generally prescribe for Medoro. And Udvartana, now it's like scrubbing therapy, we can say. So इसमें जो चूर्ण यूज करते हैं, त्रिफला चूर्ण, कोलकुल्थादीन, एलादी चूर्ण, we generally used in OPDs. Herbs of Medoroga, Trifla and Guglu, Silajitu, and other. These are the most common combination we use in Medoroga. If it's not like a tackle with diet and lifestyle, बहुत ज़्यादा BMI है और काफी complications और भी साथ में, फिर हमें उनको मेडिसिन रिकमेंड करनी पड़ती है. Like नमक गुगलू, मेदोहर गुगलू, विषादी गुगलू, पंचकुल चूर्णा, वर्णादि कसायम and विडंगादि चूर्णा. So these guglu must be chew for better results. Otherwise उसका उतना इफेक्ट नहीं आएगा. So generally we recommend patient like if they are having the guglus for their weight management, so they have must to first crush and they have to chew for better results. Otherwise वो उतना work नहीं करेगा. According to Ayurveda, हमारी डाइट क्या होनी चाहिए? Whole grains like barley, whole oats, quinoa, amaranth, vegetable का bottle gourd, asgard, spinach, cabbage, carrot, and cauliflower. And depends also. कोई allergy तो नहीं है उनको. And is there any other factors also there? If someone is like a hypothyroidism, so we have to avoid cabbage and cauliflower. Pulses, moong dal is better. Moong dal को आयुर्वेदा में बोला कि it's the best one. We can consume every day. Fruits, apples, pear, and pineapple. Honey with normal water. I would not recommend honey with warm water. Generally, it's very like it's like kind of false myth in society. वो एक warm water के साथ में honey ऐड करके उसको एक सबसे बड़ा उसको एक ऐसे home remedies मानते हैं कि it will burn fat. But it's better with normal water. They can have honey and they can have warm water with lemon. Spices like fenugreek, turmeric, cumin, coriander. ये better होंगी if you can use in the raw form, not like in the powder form. Curry leaves, ginger, black pepper, clove, and cinnamon. Diet to avoid sweet, sour, salty, and oily food as it is aggravate kapha and meda. Sweet foods like not only sugar like a wheat, pasta, breads, and other meat products, cakes, all the bakery products, meat, especially red meat and fried non-vegetarian items, all the packaged and processed food. Avoid incompatible combinations of food. Just like in Ayurveda, there's a mentioned about the Viruddha Ahara. So we have to avoid this kind of combinations like milk with fish, meat, curd, bread containing yeast, cherries and yogurt, yogurt with milk, melons, hot drinks, meat, fish, mangoes and cheese, eggs with milk, melons, fruits with any other food. Meduroga obesity. Generally, we recommend exercise like either like a yoga part, either they are doing some kind of Zumba, at least they have to do some workout, either swimming, either aerobic exercises. Some yogasana are recommended like a Surya Namaskara. अगर उनके पास time नहीं है तो we can recommend at least they can do Surya Namaskara. Initially 6 sets each day, later on 12 sets each day. Pawan Muktasana, Uttan Padasana, Dvichakrikasana, Naukasana they can do. And pranayama and meditation also helps if someone having the breathing issue along with that. And meditation, Yoga Nidra meditation helps in those conditions if someone having some psychosomatic issues or depression kind of thing. So obesity, for obesity and Medoroga, we recommend few things like generally whenever a person come in our OPDs, जब हम देखते हैं, so they want to lose weight, but they are only want the medicines part. They want, okay, give us some magic pills, some magic remedies to lose weight, and all the medicines not work in every patient. So whenever we ask as a dincharya, so the root cause we find in their dincharya. Some they have a habit of day sleeping, the diva swapna. This one is also the biggest cause in this diva swapna. Some have the faulty dietary habits. Some have avoiding their breakfast, avoiding their lunch. So whenever we ask patients, so dincharya makes a very important part, and according to their dincharya, we recommend them customized dincharya. So you have to follow the particular dincharya. So as a student of Swasthavrita, I recommend the first thing to the recommendation to the patient is dincharya. What kind of dincharya we are recommending to the patient or person. So maintain a regular routine, like wake up at least 5 a.m. or 6 a.m. depends on their schedules. Take 2 teaspoons of lemon juice with glass of lukewarm water, and we also recommend them drink lukewarm water every time, just not warm but at least lukewarm. So just for maintaining the agni and opening the block channels. Exercise at morning at least 30 minutes per day, and 4 days a week if possible. If otherwise every day, other if not possible every day, then at least 4 days per week. Eat light nourishing breakfast like a chila, oats chila, ragi chila, moong dal chila, porridge, oats, amaranth, this kind of porridges. Red poha, instead of normal poha, they can have red rice poha, utpam, vegetable utpam, and these kind of things. Use whole spices and herbs while cooking instead of the powder form. Boil water with fresh ginger. It also works as a dipana pachana, and drink frequently throughout the day. Make lunch as a meal, and they can also have buttermilk if suitable to according to the particular ritu and their the prakriti. Dinner should be light as light possible. Avoid day sleep habit. That diva swapna is contraindicated. Only during summers is recommended for few hours. Eat only after digestion of previous meal. So वो हमें देखना पड़ेगा कि the previous meal is already digested or not, or we are taking our meal according to the time. Avoid eating late at night. It's very common nowadays. Someone is like due to their studies, due to their late jobs and all, so they are having late night food. Eat only when we are hungry. Find our correct quantity. Keep the regular timings of the meal. Eat mindfully. This one is also the we can focus the mindfully. Some nowadays we are eating with watching web series, with talking to other family members. We are not focusing on what we are eating. So because of that, we are eating too much quantity. Concentrate on your food, what we are eating. Don't divide our attention by reading, walking, or watching. Vajrasana after every meal is recommended. If we will having Vajrasana, diamond pose after every meal, it will helps to press Katik Taruna Marma point by our heels. So it secret digestive juices. So we generally recommend to every patient of Medoroga, so they can have the Vajrasana after every, only one asana we can recommend after meal. So it helps a lot. Replace caffeinated and carbonated beverages with herbal teas. We generally recommend them just avoid coffee, tea, and other soft drinks, and just have herbal teas. And if they want something kind of snacks, the makhana foxtrot is with good source and light snacks. Fasting one day in a week or either during Ekadasi. It's like a langhanam, is part of langhanam कि एक दिन body को rest देना है. Kind of नवरात्रि में जो like according to Ayurveda, langhanam is उसको बहुत importance दिया गया है. So we recommend our patient also, if they can fast according to their horoscope also, that will help in both way, physically health in health wise also, and the spiritually also. And either if they can do fasting on Ekadasi, it's very scientific. Now it's also the foreigners, westerners also doing the fasting on Ekadasis. And during Navratris also we can say the Sardiya Navratri and both Navratris, क्योंकि जो फेज होता है दोनों मौसम चेंज होने का, so it also build our immunity and also give a chance for natural detoxification, natural cleansing. Prevent obesity is avoid it stress. It's a big thing. अगर हम stress ले रहे हैं, हम कर रहे हैं, तो ये बिना reasons के it increase our weight. Get enough sleep. Sleep is big important. Like ahar nidra brahmacharya is a part of Tripastam. So we have to focus on mainly the two things, ahara and nidra. Eat fasting, stop eating fast food, do physical exercises, eat more fruits and vegetables, and mainly not all kind of, mainly seasonal. Get rid of bad habits, drink enough water and less TV. Eat healthy, feel healthy, and be healthy. Thank you. And lastly, I would like to thank you so much, Professor Gnutri sir, for always guiding me and supporting me. And thank you, Dr. Pawan Sharma sir, for providing such a great platform and giving me opportunity. Thank you, Dr. Professor Vishnu Sharma sir, and thank you, Dr. Bita ma'am, enhancing my knowledge. Thank you so much. Thank you, everyone.
Thank you, Dr. Tejendra. Thank you. Keep it up. Excellent.
Thank you, sir.
Very nicely and proudly you have explained everything. Very nice. Agnihotri sir. Now we will start second webinar.
तो
Please.
बहुत मजे लगा दिए दोनों लोगों ने। भले अमिता जी ने बात कही अपनी डिटेल्स से, अविता जी ने, और उसके बाद हमारे डॉक्टर तेजन जी ने, दोनों ने अच्छी बातें बताई। एक जगह हम स्टूडेंट की हैसियत से फंस रहे हैं, थोड़ा हमें निकालो भाई। डॉक्टर तेजेंद्र जी, एज ए स्टूडेंट हम फंस रहे हैं, थोड़ा निकालिए हमको। आपने कहा ये जो मेदस्वी लोग हैं, जो ओबीज लोग हैं, इनको भोजन करने के बाद कुछ आपने बताया वज्रासन करना चाहिए।
हाँ जी, हाँ जी,
है ना? वो तो इन जनरल भी है, वज्रासन करने से हमारा बचाया हुआ खाया हुआ खाना अच्छे से पच जाता है।
हाँ जी,
लेकिन मेरे एज ए स्टूडेंट दिमाग में बात आई, वो कितना भी खा लें, वज्रासन बैठेंगे 15-20 मिनट बाद जब उनको वज्रासन का असर आएगा, उनका भोजन पच जाएगा तो वो फिर खाने लगेंगे। It may amount indirectly for the obesity when he will or he or she will keep on taking much more things as if they might be feeling hunger. You have to think twice.